ऑर्थोपेडिक ट्रॉमा इंट्रोडक्शन। टॉपिक है क्लासिफिकेशन ऑफ फ्रैक्चर्स। एन इंजरी ऑफ द musculoskeletal system can result in damage to bones, joints, muscles, and tendons. In addition, the neurovascular bundle of the limb may be damaged. This section will outline the broad principles used in diagnosis and management of these injuries. These principles can be applied with suitable modifications in the management of any musculoskeletal injury. Classification of fractures. If fracture is a break continuity of a bone, it can be classified on the basis of etiology, the relationship of the fracture with the internal environment, the displacement of the fracture, and the pattern of the fracture. On the basis of etiology, traumatic fracture first. A fracture sustained due to trauma is called a traumatic fracture. Normal bone can withstand considerable force and breaks only when subjected to excessive force. Most fractures seen in day practice fall into the category that is fracture caused by a fall, road traffic accident, fight, fight, etc. Pathological fracture. A fracture through a bone which has been made weak by some underlying disease is called a pathological fracture. A trivial or no force may be required to such a fracture, that is a fracture through a home weakened by metastasis. Although traumatic fractures have a predictable and generally successful outcome, pathological fractures often go into an non-union. Stress fracture. This is a special type of fracture sustained due to chronic repetitive injury or stress causing a break in bony trabeculae. These often present as only pain and may not be visible on X-rays. On the basis of displacements. Undisplaced fracture. These fractures are easy to identify by the absence of significant displacement. Displaced fracture. A fracture may be displaced. The fracture responsible for displacement are the fracturing force, the muscle pull in the fracture fragments, and the gravity. While describing the displacement of a fracture, conventionally it is the displacement of the distal fragment in relation to the proximal fragment which is mentioned. The displacement can be in the form of shift, angulation, or rotation. On the basis of relationship with external environment, closed fracture. A fracture not communicating with the external environment, that is the overlying skin and other soft tissues are intact, is called closed fracture. Open fracture. A fracture with break in the overlying skin and soft tissues leading to the fracture communicating with the external environment is called an open fracture. So, called internally or externally open fracture respectively. Internally open. The sharp fracture end pierces the skin from within, resulting in an open fracture. Externally open fracture. The object causing the fracture lacerates the skin and soft tissues over the bone as it breaks the bone, resulting in an open fracture. Exposure of an open fracture to the internal environment makes it prone to infection. This risk is more in externally open fractures. On the basis of complexity of treatment. Fracture. A fracture in two pieces, usually easy to treat, is called simple fracture. That is a transverse fracture of humerus. Then complex fracture. A fracture is multiple pieces, usually difficult to treat, is called complex fracture. That is a comminuted fracture of tibia. On the basis of quantum of force causing fracture. High velocity injury. Then low velocity injury. In the basis of pattern में transverse fracture, oblique fracture, spiral fracture, comminuted fracture, segmental fracture. And this fracture with eponyms. Montage fracture, Gallagher fracture, nightstick fracture, Colles fracture, Smith fracture, Barton's fracture, Chaufflier fracture, Boxer fracture, side skip fracture, Pumper's fracture, Pilon fracture, Exeter's fracture, Coppard fracture, Jones fracture, Ronaldo fracture, Jefferson's fracture, whiplash injury, Chance fracture, March fracture, burst fracture, Clay Shawler fracture, Hangman's fracture, dashboard fracture, stellar fracture, Malgen's fracture, and middle finger, mallet finger. Then pathological fractures के causes. Bone may be rendered weak by the disease localized in the particular bone or by a generalized bone disorder. Gives some of the common causes of pathological fractures. Osteoporosis is the common cause of pathological fracture. The bone most often affected are the vertebral bodies, thoracic and lumbar. Other common fractures associated with osteoporosis are fracture of the neck, femur, and Colles fracture. Then these are some tables related to these fractures. Then diagnosis, treatment, injuries of joints, then injuries to ligaments, then fair classification: first degree sprain, second degree sprain, third degree sprain, then pathology, then fair diagnosis. These are some of the figures. Clinical examination, then investigations, plain x-ray, then treatment, MRI extra, injuries to muscle and tendons, then pathology, and hence it is completed.